Today we'll be talking about a concept which is orthostatic syncope. Now, what mistake? This is the mistake which I have also done, and I think many people, Indian students, they do is that they call it as syncope, but the real pronunciation of it is syncope. It is actually syncope. Or better syncope. Okay, so now that we have discussed the pronunciation of syncope, I'd like to tell you what is syncope. Syncope is a brief loss of consciousness. So it is a brief loss of consciousness. Now, then what is orthostatic? Orthostatic means, ortho in Greek means straightforward, or straight up means standing straight up, and stasis, the word static from comes from stasis, which means something which is not flowing, which is in constant, which is sort of filled up, constant, not flowing, like a water in a pond, not water in a river. So water in a river is flowing, water in a pond is in stasis. So orthostasis, by definition, orthostatic means there is stasis of blood when you stand up. So when you stand up, there is stasis of blood. Because of this stasis of blood, there is syncope. Now that we have defined what is orthostatic syncope, now we will continue this discussion further, and this video we will divide into three topics, three small further subtopics, which are: first is what is orthostatic syncope, why exactly it happens, and third one is which drugs can cause orthostatic syncope. Okay, so moving to what it is, I have already given you a word breakdown, and I have told you the outlining definition of what it is. Now, let's understand the mechanism behind it. The mechanism behind it is that when you are sitting in supine position, when you are in supine position and you try to get up, and you try to get up from the supine position, what is going to happen is the blood, which is equally distributed from your head to toe in supine position, will have a tendency to pull down. And so blood has a natural tendency to pull down. Why does it have a natural tendency to pull down? Because it is a liquid. When if somebody is like this, he goes from this position to this position, obviously the blood is going to pull down because it is a liquid. Any liquid from sleeping to standing position will pull down. But where does this blood get pulls down? It gets pulls down in your veins. So if all the blood or a major portion of blood is pooled within the veins, then will the blood go back to the heart? No, it will not go back to the heart. So there is less blood returning to the heart. If there is less blood returning to the heart, when the person suddenly stands up, there is less blood returning to the heart. Less blood returning to the heart, the end diastolic volume, end systolic volume, stroke volume, all these parameters will go up or they will go down. Yes, they will go down. So if the heart is not pumping enough blood when the person stands up, will the brain get enough of blood and will the brain get enough of oxygen? No, the brain will not get enough of oxygen. Brain not getting blood. If the brain is not getting blood, then will the brain be able to maintain consciousness? No, there is going to be loss of consciousness. This is the mechanism of orthostatic syncope. So every time you stand up from the sleeping position, you stand up. So this all happens that. But now you will say that, sir, you must be joking, because I am standing up from so many years. I am 20-year-old or 30-year-old person, and it has never happened to me. I stand up many times from sleeping position throughout the day. It has never ever happened to me in my life. It is because it does not happen in normal individuals, because the body has certain mechanisms to counteract this natural tendency of the blood to cool down. Now we'll discuss why it happens in certain individuals. It only happens in certain individuals during certain conditions, or when they are taking certain drugs. Normally it does not happen. Normally it does not happen because I have drawn over here, this is your heart. This is your heart, and on the heart, whenever the heart is getting less blood back from the body, so the blood is getting pulled down within the body, within the veins, the heart is getting less blood from the body. There are something called as, over here I've drawn, are your baroreceptors. Now what is gonna happen is, these are your baroreceptors in the heart. These are the carotid baroreceptors and the aortic baroreceptors. So these carotid baroreceptors and the aortic baroreceptors, whenever they get less blood coming to the heart, they send a signal to the brain. They say that, the heart, I am getting less blood, so I cannot give you that much of blood, so you are going to have problems. So do something about it. That the heart tells to the brain with the help of these carotid and the aortic baroreceptors. So what happens is, the signal from the baroreceptors goes till the brain, and the structure which you are seeing here in the brain, which I have drawn in the cream color, is the uh, cardio-regulatory center in the brain stem. Now this center from the brain stem receives the signal, and what it does is that, to regulate the blood pressure and to regulate the blood which is coming back to the heart, it is going to send parasympathetic as well as sympathetic nerve fibers back to the heart. And what's going to happen, it's going to increase the heart rate, and it is going to increase the contractility of the heart. How is that going to happen? Heart is going to increase the sympathetic stimulation, and it is going to decrease the parasympathetic stimulation. So there will be a decrease in parasympathetic stimulation, increase in sympathetic stimulation. That will cause increase in the heart rate, increase in the contractility. So these are the two mechanisms by which the heart is maintaining its blood pressure. There is also another mechanism. Now this cardioregulatory center goes down to the through the sympathetic ganglion. This here, what I have drawn, is the sympathetic ganglion. Through the sympathetic ganglion, the heart sends signals to all the brain sends signal to all the blood vessels to constrict itself, to cause vasoconstriction. So if the vessels are constricting, they are becoming narrower, the return of blood flow is going to be more, and the blood pressure is also going to be more. So overall, there are three mechanisms by which the brain is increasing the blood which can return to the heart, which is increase in the heart rate, increase in the contractility, and overall vasoconstriction. Now we will quickly go to what are the drugs which can cause this orthostatic syncopes. There are certain drugs which can cause the orthostatic syncope. Now, basically, I have told you that there are three mechanisms: increase heart rate, increase contractility, and vasoconstriction. Any drug which interferes with one or more than one of these will cause orthostatic syncope. Now, if any drug is interfering with the heart rate, or there is chance of orthostatic hypotension or orthostatic syncope. Any chance of a drug affecting with the contractility, drug causing vasodilation. So all these drugs I have written, I have made a list. And this is the list of the drugs. There are the drugs which can cause vasodilation. I have listed it out. You can stop the video over here. You can note down the list. If the patient is on any of these vasodilatory drugs, there is a chance of orthostatic syncope. And similarly, any drug which is causing volume depletion, which is commonly your diuretics and SGLT2 inhibitors, which are used for diabetes mellitus. These can also cause orthostatic syncope. And again, any drug that is causing blockade of the sympathetic nervous system will make the person prone to orthostatic hypotension or orthostatic syncope. Drugs have written beta blockers and clonidine. So note down these drugs. You need to remember the list of these drugs. If the patient is taking these drugs, he is prone to develop orthostatic hypotension. But what are some non-medication causes of orthostatic hypotension or orthostatic syncope? Means the person is not taking any medication. Still, he has a chance that he will get a orthostatic syncopal episode or orthostatic hypotension episode. They are your dehydration, your diarrhea, your blood loss. Basically, anything that depletes the volume, the overall blood volume is less. So, overall blood volume is less, and a part of that blood volume is getting stuck in the lower limbs. Then, when the person abruptly stands up, he has a chance of feeling dizzy and falling down. Okay, so this was your orthostatic hypotension.